The change that America wants and deserves, we now understand is not going to happen right here in Washington, D.C. alone. The change that we want and we need is going to happen only if we make the kind of changes we are willing to fight for. We need to appreciate that winning an election, as we like to say in the union movement, is different than getting a contract. That elections are only opportunities to get things done, but we need to take advantage of those opportunities.
I wish we would have had the Employee Free Choice Act when we were fighting for our union, because it just would have been totally different.
If we had the Employee Free Choice Act as law, nurses could organize without being afraid.
People wouldn't be scared to come to work. If they want a union, they can openly say, we want a union.
The main reason why I'm so active and passionate about this is because I'm living proof of what's going on. And my child is living proof, that his friends are living proof, that there is not affordable health care out there.
Local folks tonight are making sure Washington lawmakers listen to what they have to say when it comes to health care and other important issues.
We're glad you're here and at this House meeting about health care reform.
We have to make sure that this conversation is happening in every living room across the state. That there is a letter to the editor in every paper across this state. So how do we do it? Where does this all start? It starts in conversations like this. It starts with House meetings.
There are people in this state and in this town who are really struggling, and they're looking for answers, they're looking for solutions, they want to get involved.
Tony Connie is with Tennessee Change That Works. The organization is working with community organizers in Middle Tennessee.
Our economy is in crisis, as everybody knows, and a big part of that is because of the rising cost of health care.
And what are you doing out here today?
Out here advocating for Employee Free Choice Act, trying to give the American worker their rights back in the workplace, man. That's what we're out here for. Fighting hard, man. Employee Free Choice! Give the workers back their voice! Employee Free Choice! Give the workers back their voice!
In each neighborhood, these are steps of change they're pushing for. One door at a time.
It was great to meet you.
Thank you.
Taking it one step at a time, that's what volunteers say it's going to take to get their word across. Now, they say it's not easy going up to each home, but it is well worth it.
We're here because we want to say with one united voice, the right to organize is a basic human right, and we're not going to let anyone take it away from us.
We wanted to form a union to ensure the best continued care for our patients and adequately support our families and ourselves. And we presented our petition to have an election, and that's when management got nasty.
We've got 1 million cards signed for the Employee Free Choice Act by just normal average American workers. And we're trying to make the point to the Senate and the House that this is one of the most important bills. The masses are really wanting this bill. So to bring the wages up for everybody in the country. You raise the wages for the little people, it's a trickle-up effect instead of a trickle-down effect. Trickle-down economics hasn't worked. It's time to make a change.
I'm actually saying justice. I'm really saying justice.
It's gonna go.
And it's good.
Some activists here in Virginia say the secret to revitalizing the economy isn't to spend more, it's for workers to organize. CBS 6's Sam Brock joins us live from the state capitol, where a rally for more unions is just wrapped up. Sam, exactly what do these groups want?
With a bold contention, increase participation in unions by 5%, and what you will see is an injection of approximately $1 billion annually in an ailing Virginia economy.
I'm a registered nurse just in Prince George's County, Maryland. Been there 34 years at a free senior health center. And I'm here with my fellow nurses from SEIU. One of the things we want to make sure is that nurses are represented in the healthcare reform committees because we want to be there on behalf of our fellow nurses and on behalf of the patients that we sometimes have to speak up for.
I'm biased towards nurses. I just like nurses. I guarantee you nurses were part of the Healthcare Summit, and they will be at the table in all these discussions.
We generated 750,000 emails across this country making sure that people understood what was at stake in this country. And we had our members on the Hill, 20 of them, going to members of Congress every single day, telling their story about what would happen if we didn't have big, bold action. And it worked. President Obama signed into law an Economic Recovery Act that is close to $800 billion. Hard to imagine those numbers just a few months ago, but we actually did it. And it's going to make a difference across this country. So I thank you for your work, but that's just the first step. We have a lot of work to do.
Simple reason. We love our country. We happen to think America is a gift. And its greatest gift has been that people who work hard, take responsibility for their family like Francisco, are able to have a chance at the middle class, but most importantly, they get to see their children lead a better life than their parents.
You are the difference.
We are the difference.
Need to participate. We are the difference.
And we want to tell them we want an economy that works for everyone. We want